Thank you very much, Nelson. Good evening, ladies and gentlemen. It's my privilege tonight to introduce one of our Deming Cup Award winners, Dr. Brent James. Brent's here tonight with his brother Alan, and he's also here tonight with several of his friends and colleagues from Intermountain Health. And I'd like to make a special welcome to Charles Sorensen, who's the president and CEO of Intermountain Health, right over here. Charles, welcome. We are really fortunate tonight with two great honorees, and the man I get to introduce is a unique American treasure. He's a humble man, he's a leader, he's a pioneer, he's a scientist who collaborated with Dr. Deming for years and years, and he's a man on a mission. And that mission is to apply Deming's principles to improve the quality of delivery of health care. Brent's always been on a mission. I mean, how many of us can say that in high school when we were out doing our chores, we took our calculus book so we could read it in between doing the chores? There's not many, Brent. From the beginning of his medical career, he's been working on reducing the massive variation in healthcare. He started over 25 years ago with teams at Intermountain to identify the causes of variation and eliminate them. He started working with Dr. Deming in 1987. All of Deming's work fit everything that Brent was doing. Everything he was seeing in healthcare. He loved the Deming principle that higher quality could result in lower cost. So Brent set out to prove that in his studies, and he proved it time and time again with the studies at Intermountain Healthcare. He wrote the first major paper on the application of quality improvement principles in the use of clinical healthcare medicine. That paper, called Quality Management for Healthcare Delivery, is still used today as the standard for teaching physicians about quality. He pursues his mission in so many ways. First, he's made the name Intermountain synonymous with quality. As the quality director at Intermountain Healthcare and the COO, he's responsible for some of the best practices in the world at 23 hospitals, 160 clinics, an 850-plus member physician group, and serving more than 500,000 people in their system. He brings his steadfast commitment to creating a learning organization. Brent developed the Institute for Healthcare Delivery Research and the seminal Advanced Training Program class to educate healthcare executives not only on the methods necessary to improve quality, but also the necessary methods to execute quality change. To date, nearly 5,000 healthcare executives from all over the world have taken Brent's classes. He's also passionate about leverage. His work has led to a requirement that new board-certified physicians pass a written and an oral exam on systems theory and quality improvement based on Deming's principles and also Brent's applications. Brent also brings leadership. It's demonstrated over and over by his timeless contribution of time and talent to organizations like the Institute of Medicine's National Roundtable on Quality, the Committee on Quality of Healthcare in America, and his efforts to create the first Malcolm Baldrige Award for healthcare. There's one thing that also Brent brings to Intermountain Healthcare, and it's indisputable, and that's results. It's a better healthcare system, it's better service, it's better care, it's lower cost, and it's better outcomes. Dr. Deming once famously said, "In God we trust, and all others must bring data." Well, the data's in. Intermountain is widely recognized among the lowest cost, highest quality healthcare providers in the world. Even President Obama has taken notice. He noted that if all doctors practiced to the standard of Intermountain Healthcare in Salt Lake City, Medicare would cost 40% less. Just one point here. So tonight, it's our turn to take note. If we're ultimately to succeed in changing our healthcare system and making it better, providing the best patient outcome at the lowest necessary cost, I have no doubt it's going to be Brent James's pioneering work that's going to lead the way. So ladies and gentlemen, it's my pleasure to honor and introduce Dr. Brent James. Thank you.